Thank you, Your Excellency. The President of the General Assembly, the Directors, the Deputy Secretary General, DG Tedros, Honorable Ministers, Your Excellencies, stakeholders, CSOs, and communities. It is my honor to address you today as the Vice Chair of the Stop TB Partnership at this hearing that is essential to the development of the first draft of the political declaration, the outcome document of the upcoming UHLM on TB. And here in my hand are the UHLM key asks from the TB stakeholders. Excellency, you can have a copy. If you wonder what the global TB community expects to see in the political declaration, this is the answer. Distinguished representatives of member states, if you adopt this, we can all go home. Everything is here in this document. There are six key asks. And to emphasize how important they are, I will spend a minute of my time to read them out. Key ask number 1, reach all people affected by TB with prevention, diagnosis, treatment, and care by implementing evidence-based quality interventions and tools as per the latest international guidelines. 2, ensure all national TB response are equitable, inclusive, gender-sensitive, right-based, and people-centered. 3, accelerate the research, development, rollout, and access to new TB vaccines, diagnostics, drugs, and other essential new tools, including digital health technology, geared to the needs of most neglected, key and vulnerable populations. 4, invest the funds necessary to end TB. 5, prioritize TB across systems for health, universal health coverage, primary health care, pandemic prevention, preparedness and response, and antimicrobial resistance. 6, ensure decisive and accountable global, regional, national leadership, including regular UN reporting and review. Each of the asks is supported by specific commitments and targets. For example, under key ask 6, the one on accountable leadership, there are 9 commitments for the global, regional, and national accountability. Your Excellency, now let me emphasize that true accountability can only come from outside. You cannot be your own auditor. And nobody is better placed to ensure accountability than civil society and those personally affected by the disease. This brings me to this document, the Daily Divide, the accountability report of the TB-affected communities and civil society, priorities to close the Daily Divide, which I am now honored to officially launch right here and right now. Over 1,000 partners from TB-affected communities and civil society organizations from 92 countries engaged in the development of this report, which brings TB realities on the ground to the forefront. It highlights the powerful solutions and coping strategies, and its calls to action reflects the vision on what it takes to end TB by 2030. And it's in full alignment as well with the key ask. The report, like the key ask, calls the commitment of multi-sectoral action, decisive leadership, and accountability, and demands, among others, the need to apply community-led monitoring models. Just a few days ago, the WHO announced that after 3 years and 4 months, COVID-19 is no longer a public health emergency of international concern. Let me remind you that TB has kept the title of Global Health Emergency since 1993. In this key ask is the pathway to ripping TB off that title. Our today's panelists will give context for the key ask and provide distinguished representatives of the member states with what is needed to ensure a strong political declaration. Your Excellency, when developing it, Please think about 1.5 million human lives lost every day, every year due to TB. And you heard the Deputy Secretary General made that comment as well. Think about 1.1 million children and young adolescents who fall ill with TB every year, and more than 225,000 of them die. Our progress so far is impressive, I must say, but not sufficient. That is why it is so important that every and each one of us in this room today agree that we cannot let TB to win and continue as an airborne pandemic. We need to ensure that political declaration sets the bar high and that we are ready to go far and beyond to turn the commitments into action. Yes, we can end TB. Thank you.
I thank the Vice Chair of Stop TB Partnership Board, and I particularly thank him for walking the talk. Now we can feel in this chamber that our room is being filled by promise, energy, determination, and will. That is what we need to carry on. Transformation has started. Thank you very much indeed.
Thank you. Thank you very much. So we've heard of the avoidable deaths and the untold suffering that TB causes and the numerous personal stories. Indeed, I will say that I cannot think of a greater tractable threat where we fail to effectively tackle as a species. Yet, why is the outrage? Why are we not more angry, and why are we not acting in the same way we acted with the COVID-19 pandemic? TB is a major tragedy of our times, sadly invisible to many. But there is hope. There is hope that if we work collectively across sectors and across stakeholders to change the narrative, to change the lived experience of millions of people globally, we can make progress. To do so, we need to work together across the three interrelated areas of multi-sectoral action that I will articulate. The first, for me, is health equity. The COVID-19 pandemic has exerted the greatest toll on the people who have the least ability to bear its burden. Indeed, they've had the worst outcomes, and they've also had worst economic and social impact due to the policy responses from COVID-19. Similarly, while we know that TB can affect any one of us, it disproportionately affects the most vulnerable. Here, it seems to me, is the key to the lack of outrage. For too many of us, TB is something that simply happens to other people, either people who are invisible to us because they are in faraway countries, or people who are invisible to us in our neighborhoods because they are marginalized, poor, and or simply just not like us. We have much to learn from the COVID pandemic. There is strong evidence that global control and elimination efforts for TB are being adversely affected, and the impact has been felt in an inequitable manner between countries, between rich and poor, between neighborhoods, between world regions, and among those with specific vulnerabilities such as migrants. However, the pandemic has also enlightened us that it is possible for humanity, it's possible for society to respond at scale, to rapidly evaluate vaccines, to rapidly evaluate diagnostics and treatments. It is truly amazing to reflect on what can be achieved when the scientific community, policymakers and heads of states pull together to act. As society is rebuilt, we need to reinvigorate the TB response in a way that puts the needs of the most vulnerable at the very top of the agenda, and we must address the social determinants of health. Second, I'm excited by the unprecedented attention that many health priorities are going to receive here and in September. TB, PPPR, and UHC, all really important areas where if we work together, there could be multiple synergies and clear wins for global health and national economies. TB is a global emergency, but many of those who need care are denied universal health coverage or have barriers. No one goes to a health practitioner with a self-diagnosed TB, so only through access to UHC can ensure good TB care. Nevertheless, UHC must include specific tools, novel vaccines and diagnostics for TB, with a very clear commitment to find cases early and to ensure that they get the shortest possible effective treatment. There are many altruistic reasons why we should work to eliminate TB. However, I believe there is also an important health security imperative that our world leaders must recognize. Preventing pandemics and TB is simply a lightened self-interest. I therefore call on the immediate prioritization of equitable access to care as a cross-cutting theme across all the three conversations that would happen over the next day or so. Indeed, I think we need to close the know-how, do-how gap, as my colleague Dr. Madhukar Pai would say. How do we do this? I would agree with my colleague that we need to get together and implement the WHO Director General's flagship initiative on TB and fast-track the process towards ending TB and achieving universal health coverage by 2030. Finally, I would say that we will not eliminate TB unless there is sufficient funding and independent accountability at all levels. We will measure success by using data and metrics synthesized by the Global TB Program at the WHO, and we shall ask our leaders to agree to be accountable on a global stage, judged by a trio of equal partners, TB survivors, civil society, and the jury of their peers. Thank you.
Thank you. I'm proud to represent the Global TB Caucus, which numbers 2,500 parliamentarians across 150 countries. And since we were formed, we have helped to establish 50 national caucuses in parliaments. On the way here, I stopped at a cafe and a guy asked me what my PIN was. I told him it was to end TB. He told me that he had had TB when he was age 16 in Ohio. It was a reminder to me that TB anywhere is TB everywhere. But what has changed? What has changed in 58 years? Well, we know that at least 50 million people have lost their lives since then, perhaps twice that number. We don't have the figures. We still don't have a vaccine. Many of us were here in this building 5 years ago for the stakeholding hearings and then for the high-level meeting itself. The declaration that was passed was a fine one, but we know what has happened since. Yes, COVID has knocked us badly off course, but the truth is, if we're honest with ourselves, that we would have been off course anyway, even if COVID had not intervened. And the targets, the bold, brave new targets that were set then to put us back on course to meet the Sustainable Development Goal of ending TB by 2030 would not have been met. That is the reality. And I want to make one key point. Without strong accountability, it is not enough for leaders to be in this building again and to make declarations again when we come to the high-level meeting in September. They must be held to account for what they agree to. They must be held to account for providing the finance and for taking the necessary action to end TB. And without that strong accountability mechanism, we will find ourselves back in this building in another 5 years and in another 5 years, and it is simply unacceptable. We must hold our leaders to account now for taking the action to beat this entirely beatable disease.
Thank you.
Thank moderator for the opportunity. I believe I'm the last speaker, not because funding is not important, but probably you have decided to keep the best for the last, because let's be honest, all what we have discussed, without funding, nothing will happen. I believe that what stands between the senseless death we are seeing in tuberculosis and ending TB is money. And it's more urgent now than before. So the TB response has been really implemented with the chronic underfunding for so many years. But the business case of really funding TB is very clear. It's the largest killer, infectious killer, and probably this year will surpass HIV. It's a curable disease. TB is a pandemic. It was announced global emergency over 30 years ago. And we know also investing in TB is a smart investment. The return on investment on tuberculosis is huge. For every dollar invested in TB, there is $40, which is gain only by investing in TB. The Copenhagen Consensus has put tuberculosis as one of the cost-effective, impactful interventions. So I think the case is very clear and is very solid. My organization, the Global Fund, is investing around 800 million a year on tuberculosis. And yet, we are the largest funder internationally for tuberculosis. But let's look at the 800 million. In the larger scheme of things, this is just a budget of mid-sized hospital in most developing countries. So that shows the limited funding which we have in tuberculosis. Stop TB global plan is very clear. We need 15 billion from this year to mount a full TB response. We need about 22 billion by 2026 and 35 billion by 2030. If you look at this, you will think this is a lot of money. But if you see what we have invested in COVID, this is just a fraction of the funding which was invested in COVID. So we really need to invest in tuberculosis, and we need to make sure that countries invest their own money on tuberculosis. What we would wish to see in September is that countries come with a roadmap on how they can full fund a TB response. It's not just to be able to fund, to full fund TB response, and the global plan is very clear on how countries will be able to full fund TB epidemic. We need that roadmap to be very clear with a target and with means to be able to verify that funding. We also need to make sure we increase international funding for tuberculosis. As I said, our organization, which is the biggest funder for tuberculosis, we only invest 800 million per year. We need much more to invest in organizations such Global Fund, which is supporting most of the developing countries. Investing in tuberculosis has triple benefit. One, we can turbocharge the fight against tuberculosis and save more life. But also, by investing in tuberculosis, we are creating a platform for universal health coverage, as we have seen in Japan, where they used investment in tuberculosis to create a platform for UHC. But also, investing in tuberculosis is actually investing in the pandemic preparedness, because tuberculosis is a pandemic. While we are talking about preparing for the next pandemic, why don't we work to eliminate the current pandemic? And this will be really a demonstration and a commitment that we are serious on preparing for the next pandemic. Us, in the Global Fund, we have a mechanism to support COVID. We call C19RM. And what we did with that funding, we made a very clear case that investing in the pandemics such as COVID is actually, it will make sense to invest in tuberculosis. And our organization, with the support of all partners, we were able to invest a lot in tuberculosis, and 25% of all funding which went into the COVID response, especially with the what we call portfolio optimization, went to areas which could also support TB. And we really need to make that case. There is pandemic fund now under World Bank. We must make sure that 25% of that funding goes into activity which will also support tuberculosis. And I think that case is very clear, and we need to make that. The cost of inaction, of not investing or continue with business as usual, is very huge. Between now and 2030, we'll lose about 6 million people if we continue with the current trend. The infection will increase by almost 43 million, and the cost to the global community will be more than 1 trillion. So we cannot afford not to invest in tuberculosis. The reasons which we had before not investing, they are no longer holding. We were told before COVID that there's no money, but COVID has demonstrated that there is money if there's a will. We were told before that TB programs, they are not investing money. But in the Global Fund now, I can assure you, all TB programs, they are absorbing money. Absorption rate for TB is more than 80%. So this reason doesn't stand. We were told that there's no capacity in TB programs. But we have seen in the COVID pandemic, but even now with the result we are seeing from WHO data which they are collecting, that programs are very ambitious. Currently, at the Global Fund, we are receiving funding requests, and we have seen countries are very ambitious. What stands between scaling up and continue with the business as usual is funding. So I think at the moment, the critical issue is no longer capacity, is no longer absorption, it's the funding. And at the Global Fund, we have seen a direct correlation between more funding and more implementation. So I think what I want to say is that I think there's urgency now. Most programs, they can deliver, they can absorb money, and what stands between the death we are seeing and ending TB is funding. Thank you.